I try to provide my patients with a safe space that they can talk to me about anything. We start an open dialogue about even just their background, what's going on in their life, while addressing all of their medical needs. I provide a full range of OBGYN services. These include things like prenatal care, annual well woman examinations, or any problem visits related to GYN care. I think I love about my work mainly the patients and my interactions with the patients. I like being able to provide services throughout the lifespan for women, so I'm able to see them deliver their babies after providing obstetrical care, and then I can continue following them for their routine examinations as they age. It's rewarding to be able to follow patients throughout their prenatal care and then go and deliver their baby and to see the creation of a family unit from that.